So it's been a little over 20 minutes we've been treating Anne, and we made some nice gains. I know that I didn't demonstrate hip extension, but it was limited to 10 degrees, and it's now much freer, and that's in response to freeing up the pelvic mobility. And to increase pelvic mobility, I put a piece of foam 2-inch tall, 4-inch wide, 8 inches, well, maybe 10 inches long, under each side of the pelvis like this. And we did that for 5 minutes on both sides. And then after that, I kept it there and I pushed on her sacrum, pushing it anteriorly for 5 minutes. And the end result of that was that her hip extension was much freer, but also the pelvic mobility is much freer. And you can see that I can now load it. So I can push it to a point that we call taking up the slack. I can then spring it, and there's additional movement, and it pistons. So it moves a little bit and then it recoils. And this mobility is much freer. You can see that I can take up the slack. I see her entire body moving because now the force traverses through that structure, through the pelvic structure. So I can take up the slack, I can spring it, and there's a recoil. There's a forward push and a recoil. And then now when I let go, there's this final recoil. And pushing on the sacrum now has spring mobility. Pushing on the ischium, I can take up the slack. I can spring it and it bounces. And the tone of the sacrotuberous ligament, I can now indent it slightly, and that's normal. It no longer feels like bone. So can you describe to us how you feel in response to, you just walked around and then you sat in the chair?
I feel more loose, and it's not so tight, and I feel less tense all around my sacrum.
Good. And how'd you feel in sitting?
Better.
Good, good.
Yeah.
We also reduced her side bent coccyx. So her coccyx was off to the left, so there was a deeper sulcus pushing up on her left side in comparison to the right. And I just simply pushed on soft tissues, ligaments, especially sacrospinous and sacrotuberous, on the right side, and then I pushed directly on the coccyx, pushing it to the right. I did that for 3 minutes each. It's now symmetrical. So this is day 1. I think we're off to a very good start. And this should be a one-time treatment in terms of the coccyx and in terms of restoring mobility through the pelvis. And I like to document each time I have someone with this rigid pelvis because there's nothing in the literature to describe this pattern. So I like sharing information about this rigid pattern that is treatable. I sure thank you for letting me film.